here's Dr. Maria from Heat Bootcamp with your second sequence in the prenatal exercises. So if you are pregnant, congratulations. Second, you might get some issues that you did not anticipate. For me, it's sciatica. Even if you're very fit, you might get hit with some things that you're not quite prepared for, and you're told that you can't do a lot of things. So I came up with this mixture of a upper body weight training with a lower body yoga modification to help with that opening of the hips. So what we want to do, and for this one you can either use no weights at all, but if you want a little upper body action, you can use either a little ball like a Pilates ball or a weighted ball. Doesn't matter. I wouldn't go really heavy, but you can also use a dumbbell if you don't have any balls available. So I'm going to demonstrate it with a ball, fairly light, but I like this better because you can grab it and kind of hold it. It's a little easier than the dumbbell. So the first thing is we want to get into a really nice wide stance. So this is a take on the warrior pose in yoga. If you've done this one, you're an expert. Otherwise, stay nice and wide. We want to tuck the back knee in, or the back leg in a little bit, and then rotate the other leg all the way out. So this will be your starting position right here. You should already feel a nice opening in the hip. Now the back knee, this is very important. You have to tuck this in. If you keep it straight, there's a lot of risk for injury. So make sure you tuck this in a little bit, move that one out. Now the traditional warrior pose is just without a ball or any weight, just right here. And there's like modifications of like going in or bringing it up for that stretch. Now I want to add a little upper body exercise because you will have to work a lot holding that baby. So we want to start in that traditional pose, and when you lower yourself down, we're going to bring that weight up and just kind of stretch, release, hold for 1, 2, and bring it back up to that starting position. Like I said, if at any point in time it gets too difficult, you can do the same thing without any weight if you're starting out. So just take it down, kind of reach up, drop that elbow onto your knee, bring it up for that nice good stretch, and bring it back up. Now, we can make this a little harder by just staying longer on that down leg, so just kind of holding it maybe to 5, and then bringing it up and up, or you can just go in, just hold it for a split second, and bring it back up. We would want to repeat that on the other side, but first you want to come in, recenter, and then repeat on the other side. This should be really good. It helps very well.